Live from the Bob Levy Broadcast Center overlooking the Toms River, it's time to get up, get out, do something. Wake up with Jeremy Grunin. Be a part of the show, 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Welcome back. Wake up with Jeremy Grunin, 709, 44 degrees, heading up to 77 today. March 9th, WOBM AM 1160 and 1310, News Talk Radio, streaming live on the Radio Pup app and at WOBMAM.com. 732-505-1160 to join the conversation. We are joined by Dr. Paul Demartino, gastroenterologist and fellow of the American College of Gastroenterology. Welcome, Dr. Demartino.
Good morning, Jeremy. Thank you for having me.
Can I just call you Dr. Paul because
absolutely
because I can't do that many syllables, especially in the morning.
Not a problem.
All right, so we're going to talk about one of my favorite topics in the whole wide world, which is colorectal cancer. It's something I know that my wife and I oftentimes have at night when we're having dinner with the kids. We just kind of bring it up and we just kind of spitball it. So why don't you talk to us? What is colorectal cancer?
Okay, well, I'm glad to hear that you and your wife talk about this very, very heated topic.
Well, you've met my wife, so
right? Colorectal cancer is a diagnosis that people should be very well aware of. It is the second leading cause of cancer-related deaths. So people don't oftentimes believe that. It's also the third most common cancer in both men and women. Men it's lung number 1, prostate number 2, colorectal cancer number 3. Women, it's lung number 1, breast number 2, colorectal cancer number 3. So it is a disease that people need to be aware of, and the reason they need to be aware of it can be prevented,
right?
It can be treated, and it can be beaten. So one of the topics that people always or the catchphrases is preventable, treatable, beatable, and it's true. There's no other cancer that can be screened as well as colorectal cancer.
Right. And we talk a lot here about, we had actually folks from ACS on Monday from the American Cancer Society talking about the Tides of Change Gala and the work that they're doing. And we can't drive home enough the importance of having your checks done, making sure that you are getting diagnosed regularly, especially when you get past a certain age. So in this case, who gets it? Men, women, what's the age, ethnicity?
It's all of the above, men, women, all ethnicities. And the age presently for Caucasians or people of white color is age 50.
Okay.
People of African-American descent or Puerto Rican is age 45. However, at last year's colorectal cancer fair, the theme was it's not only older people who get colorectal cancer, because there's been a pretty good surge of young people presenting with colorectal cancer. However, your previous guest was talking about the Affordable Care Act and health insurance. They're not covering it for younger than 45 in African Americans or
right.
Puerto Ricans, and younger than 50 in Caucasians. However, I tell patients if you come in and you've ever had bleeding on the tissue paper, that's enough to get a colonoscopy.
Right. Okay. So what are the risk factors? Can you control anything, or is it all hereditary, or what's the story?
Good. I'll start with the last part of that question. The minority of colorectal cancer cases are hereditary. If you draw a pie diagram, only a very small slice of the pie is hereditary. We never ignore family history of cancer, family history of polyps. So those are important risk factors. Anyone can get it, and one of the important things is it's asymptomatic. There are no symptoms. People often say, "Why do I need a colonoscopy? I'm not having symptoms."
Right.
You're not going to catch it if you wait for symptoms. It's an asymptomatic disease, generally speaking, so you want to be screened. We talked about the ages 50 in the general public, 45 in African Americans or people of Puerto Rican descent. What are the risk factors besides family history of colon cancer, family history of polyps? There's also inflammatory bowel disease, which is Crohn's disease, ulcerative colitis. There are people with what's called Lynch syndrome. And this is a very rare disorder, but it's characterized by patients who have first-degree relatives who've had ovarian or breast cancer or bladder or uterine cancers, and there's a higher risk of colorectal cancer. Though if you've had a prior polyp before or prior colon cancer, obviously you're at higher risk for a second cancer.
So, and does diet impact this? Can I have a better shot of avoiding?
Absolutely. With this study that I alluded to with last year's theme of the Colorectal Cancer Awareness Fair, we talked about younger people. There's a surge. And one of the 3 factors they believe is due to this young people presenting with colorectal cancer is dietary, sedentary lifestyle, and obesity. So diet certainly plays a role. So what we're advocating and what we've been advocating is high fiber, low fat diet. And at our fair this year, Colorectal Cancer Awareness Fair, the 12th annual fair at the hospital, we'll have a speaker, a dietitian, is going to be talking about what you can do to possibly reduce your chances of getting risk factor by changes in your diet.
You know, I got to be honest with you, Doc. It's very upsetting because I'm looking for something that I could prevent by having a higher fat, more delicious diet. I mean, I'm working on a heavy pizza, pasta, cake, ice cream diet, and I'm finding that the more I talk to you doctor types, that doesn't seem to prevent anything. That's a little upsetting to me.
I understand because it's all about taste,
right? And
things like high-fat diets, to my knowledge, don't promote any good health. But we're not ever advocating for you to avoid anything that tastes well. It's just all about moderation.
Right. Because my boy Zach over on the other side of the glass, he's a vegetarian. So he's always like he just laughs at me every time. He's like, how healthy he is. Yeah, I take the elevator up to the 4th floor. He runs up the steps, taking 3 at a time. Anyway, but I digress. All right, so the way we diagnose this is through a colonoscopy?
Correct. The most common way to diagnose colorectal cancer is via colonoscopy. That is the gold standard diagnostic test. There are other tests. There is a flexible sigmoidoscopy, which is an abbreviated test. It only looks at the left side of the colon, so you obviously will miss a large amount of cancers if you just use that. I use the analogy if you wouldn't want to send your wife or mom for a mammogram of one breast. So that's why colonoscopy is the better test. There's also what's called virtual CAT scan. And that is a high-speed CT scan that can give you nice images of the colon and create it in a 3-dimensional fashion. Unfortunately, insurance companies don't cover that. There's also hemoccult testing. We can check for occult blood that you don't see. However, that has a very low sensitivity. You're not going to pick up all colon cancers with doing that. The test hasn't been abandoned because it's inexpensive.
All right, so then I have to get a colonoscopy is what you're saying. I mean, that's really what it comes down to.
Everyone should have a colonoscopy.
And does that hurt?
Great question.
Thank you.
That's probably one of the leading causes of why people don't come for colonoscopy.
Yeah, because I'm going to be honest with you. Just like the thought, if I close my eyes and think of the word colonoscopy, I clinch a little bit, to be honest with you.
And you're not alone. There's a lot of stigmata out there that it's a painful test. So, reasons that people don't come forward probably, include 5. And one of them is, as you said, pain. And it is a painless procedure. If done with sedation, we actually use anesthesia. So the patient is not awake, not conscious, they're out. And we're monitoring throughout the entire test. We use a drug called propofol, which is a heavy anesthetic, and there's no pain. And I would say probably upwards of 90% of people who present for colonoscopy go for the anesthesia component.
Right.
You can have it done awake, but you just don't know how you're going to tolerate it until you present the test. So this is a painless test. Yes. I think the other reason is that people don't come forward is, I hear that the prep is difficult, and they're correct. There's no easy way to clean out the colon, which is a 4 to 5 foot hollow tube. Other things are people are afraid. What's going to be found?
Right.
Okay. Complications of the test. It has very, very low rate of complications. And lastly, is people say, I feel fine. Why do I need a test? And as we talked earlier, there's no symptoms. You're gonna get this test whether you have symptoms or not.
Well, I'll tell you what, Doc. I think what I'm going to do is I'm going to get knocked out. I'm going to go see Dr. Rotem, have him take care of my my dental needs. Then I'll come to maybe I can get the two of you guys in the same room together. We can take care of my mouth. Anyway, we'll have to talk about that offline. We're here with Dr. Paul Demartino. We're going to talk about the colorectal cancer the colorectal. I'm okay. Bear with me. The colorectal cancer awareness fair. Right, that's a mouthful. We need to talk about a shorter acronym, something that makes it more sexy. We're going to talk with Dr. Demartino more about after this.
Get more Wake Up with Jeremy Grunin at our website, WOBMAM.com. News Talk Radio, WOBM AM 1160 and 1310.
Welcome back. Wake Up with Jeremy Grunin. We are here with Dr. Paul Demartino. We are talking gastro, right, is what we're talking. We are, and we want to learn about the colorectal cancer awareness fair. And by the way, for Tom in Brick, high-fat diets, of course, lead to listen, there is nothing positive that comes from a high-fat diet. Right, and by the way, my wife tells me that pretty regularly, and just like everything else, after a number of years of marriage, it goes in one ear and out the other, and I eat what I'm gonna eat. Anyway, so Doc, talk to me about this. Talk to me about the 12th annual Colorectal Cancer Awareness Fair. What is this all about?
The opportunity here is we want to increase awareness, public awareness of colorectal cancer, a preventable disease and a very common disease. As we talked about earlier in the show, it's the second leading cause of cancer-related deaths. So with our fair this year, our theme is 80% by 2018, and that's an actual initiative by the American Cancer Society and United States Preventable Health Task Force. So our hospital community medical center is committed to this initiative, and what it means is getting 80% of people eligible to come forward and get screened for colorectal cancer. Interestingly, in New Jersey, we're probably at about 60%. So we're not that far off. Other places in the country are below 50%, believe it or not. So at the fair, people will have an opportunity to engage with nurses, physicians, and other health experts regarding risk modification strategies to prevent colorectal cancer, including diet, getting your colonoscopy, getting a virtual colonoscopy via CAT scan, and there'll be tables throughout the outpatient lobby occurring from 9:30 a.m. Tuesday, March 22nd through 12:30 p.m. And then later in the day, we have our second annual Colorectal Cancer Awareness Symposium, where there'll be a speaker from Dietary who's going to be talking about dietary factors that you can help reduce your risk of colorectal cancer and also heart disease, by the way, and that would be a high-fiber, low-fat diet. And I'll be discussing myths about colonoscopy.
Okay. And so, listen, we have a golf swing analysis there in the morning, right? So we could, which I could analyze my own swing already, by the way. It sucks. All right. And then in the afternoon, we have, do I see dinner is being served?
Correct.
That'll be a low-fat dinner, no doubt, right? It won't be.
I'm sure it will not be. It will not be because people won't come if it's a low-fat. You got to remember, we said earlier, you got to go with taste.
That's true.
Earlier in the fair, you're correct. From 9:30 to 12:30, there will be a golf pro, and we're talking about take a swing at colorectal cancer. So that gentleman will be analyzing golf swings. That's all free. Parking is free. There'll be light refreshments in the morning portion, and then in the evening portion, 5:30 to 7:30 p.m. Again at Community Medical Center. There will be free dinner served.
Great. No funnel cake though, and nobody's guessing my weight. There's no I can't try to pop the balloons with the dart or anything, right? It's not that
None
kind
of that,
fair.
But you're giving me an idea for next year's fair.
I'm just saying, let's make it a fair.
Yeah.
Darn it.
Yeah.
All right, when we come back, I want to learn more about you, Dr. Demartino. We're going to dive into you, how you decide to become a doctor, what you would do to change the world. We'll be back with Wake Up with Jeremy Grunin after this.
The news is next. Live from the WOBM Newsroom, the Town Square, New Jersey News Network, and Fox News Radio. Wake Up with Jeremy Grunin. News Talk Radio WOBM AM 1160 and 1310. Live from Town Square Towers, at the heart of the Jersey Shore. Wake Up with Jeremy Grunin. Get up, get out, do something. Join the conversation. 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Welcome back. Wake Up with Jeremy Grunin. 7:35, 44 degrees, getting up to 77 here. March 9th, WOBM AM 1160, 1310. It's Wednesday. It's hump day, right? And there has to be a hump and colonoscopy joke in there somewhere. I can't put it together at this moment. But we're with Dr. Paul Demartino, gastroenterologist, chair of the Colorectal Cancer Awareness Fair at Community Medical Center. Dr. Demartino, can you tell me when did you decide you wanted to get into medicine? Do you remember when that happened?
Sure. While I was in pharmacy school, and while in pharmacy school, I was doing a rotation at Harvard where I did my clinical training, and I said, I'm going to go further than pharmacy school, and I went right to medical school.
Oh,
That's
really?
where I made my decision. Yes.
So why did you get into pharmacy school? What is it? You had a drug thing?
No, I had no drug problems, thank goodness.
Okay.
But what I did in choosing to go to pharmacy school, I wanted to come out of a university with a career. That's why I chose pharmacy school.
Okay. And you thought that was the way to go. You had an interest. Had you always had an interest in medicine? Always had an interest in helping people? Always had a scientific mind?
I think I always had an interest in health, but I never thought I would get into medical school early on. When I was being raised in Brooklyn, I never thought I could do it. But when I went off to pharmacy school, I did very, very well in school, studied hard, and said I can do this. And I'm glad I did.
Are you implying there's a correlation between being raised in Brooklyn and the belief that you can't actually get through medical school? Is that?
No, there's no correlation at all.
It
was just a poor thought process on my part.
I was just curious because I have two parents who were actually born in Brooklyn who both got through law school. So I'm sure it's the same. It's the same thought process.
Yeah,
but
I think the correlation is you grow up in Brooklyn, you learn good work ethic, as your parents are a great example, and that you can lead to success.
All right, good. We'll go from there. All right. So when did you decide then you wanted to get into gastroenterology?
That was in medical school. You know, you're taught all about different topics, and what really appealed to me about gastroenterology and hepatology, you know, which is also the liver, we're also very involved in that organ. It's a field of medicine where multiple disciplines are involved. You are involved with surgery. Okay, you make decisions for people to go to surgery. You're involved with pathology, looking at the pathology of what you take biopsies of or remove. You're involved with radiology. So there's a lot of multidisciplinary approach in gastroenterology, and it's a combination of both intellectual medical thinking and also doing things with your hands via endoscopes. And that's what appealed to me about gastroenterology. And again, you can make an impact by removing potentially precancerous lesions that can lead to colon cancer.
Wow, so you really had thought this through, huh?
I did.
All right, you didn't just jump into it. All right, cool. All right, so talk to me about we've given you your magic wand, your fairy dust, your pixie dust. You can shake your nose, bewitch style, and change something, make an impact on something without legislative approval. What is it you would go ahead and do?
Okay, that's actually an interesting sight, me looking as a fairy godmother with a wand. It's kind of scary.
It is.
Anyway, what I would do, I mean, immediately when I think about this, is I would try to reduce the red tape involved in ordering testing that is medically relevant and necessary nowadays in the healthcare system. You know, I look at the women in our office who are wonderful, and I couldn't be able to do what I do without them, how much time they spend on the phone in getting pre-authorizations for testing that myself and my partner, Dr. Eschinger, order for patients who, you know, need to have the testing, but the insurance companies make it very difficult in order to get those tests. So I would try to eliminate that red tape or reduce it.
It really is. It's you know, even if you're willing to pay nowadays, it's you could come in with a blank checkbook and it still seems like it's hard to get the work done that you need to get done. It's you know, we've obviously got caught up in this incredible labyrinth of medical red tape. We heard it from our last guest. We hear it from you. And, you know, again, even if you're spending all kinds of ridiculous amounts of money on health insurance, you still can't get done what you need to get done. And it really is a shame. And so I know then you are a subscriber then to the Bernie Sanders school of let's just give everybody free health care and get everybody doing what they need to get done, right?
No, I want to be very clear that I would be very depressed and need medication if Bernie Sanders got our nomination and went on to become president.
Right.
He scares me.
All right, good. Just so, you know, I don't know if you saw the statistic, but last week after Super Tuesday, the Google reported that the amount of web searches for the phrase "move to Canada" went up like 1,500% day over day. So there, I don't know why that is. Maybe there was a correlation to the election. I can't be sure, but free health care for everyone. 60% taxation. All right, Dr. Demartino, where could I learn more about the Colorectal Cancer Awareness Fair? Where if I aside from obviously going to the YouTube and replaying this video, replaying this interview, which would be fantastic, where else can I learn more?
You can call the number at Community Medical Center, which is 1-888-724-7123. So again, 1-888 724-7123, because you do need to register if you're going to come for the second portion of the fair, which is the 5:30 to 7:30 p.m. colorectal cancer awareness speaker forum. That one you need to register because there will be free dinner.
Cool. Free dinner we're all about. So Dr. Demartino, before I thank you for coming in, I also do want to point out, listen, there are a lot of doctors who, who come in, do their job, take care of patients at a high level, and that's great, right? That is super important. We need those folks every day doing the right work. You, in addition, are on the board of trustees at Community Medical Center. You are incredibly giving of your time to try and improve the overall patient experience for folks in Ocean County. You take an active interest in total hospital operations. You've been a Little League coach. You've been active in the community. I just want to thank you for all that you're doing, not only for your patients and for your practice, but also for the greater good of the community. Thank you so much, sir.
Thank you for having me, and thank you for those kind words. I mean, I live in the county, so I care about the county.
Absolutely. Good stuff. Dr. Paul Demartino, gastroenterologist, Community Medical Center. Go learn more about the Colorectal Cancer Awareness Fair. There will be no funnel cake, but I promise you will learn a lot. All right, we'll be back right after this.